Hello, everyone, and welcome to the Health Law Institute's brand new podcast. You're probably wondering who we are, what the organization is, and why we created a podcast. Well, in today's episode, we're going to answer all those questions and give you a little bit of an introduction into what we hope to do. My name is Jacob Braun. I'm a law student in Toronto, Canada, with an interest in health law, labor law, international law, and I'm joined today by Soosmita and Suk. As well as being a licensed pharmacist and a lawyer, Soosmita is the founder and president of the Health Law Institute. How are you doing today, Soosmita?
Fine. Hello, Jacob. Excited to be here. And thanks to you and Suk to get the ball rolling.
Of course, I'm excited too. And Suk is a Canadian human rights lawyer with experience in both law and policy. How are you feeling today, Suk?
I'm doing well. Excited for this podcast.
Amazing. So before I hand it off to Suk to start us off in the conversation today, I just want to reiterate that today's episode is going to be really an introductory episode. We're not going to tackle any, specific health law issues today. Those are going to be left for future episodes. Here, we're just going to give you a little bit of an insight into what the podcast is going to be about, what the organization is about, how it started, and what its main goals are. So now I'll hand it off to Suk to start us off.
Thank you. So I'll start by asking this question to Soosmita. Your first degree was as a pharmacist, and this was in Nigeria. Could you please share some of your experiences there?
Thank you, Suk. I did grow up in Nigeria where I did most of my schooling, right from primary up to my pharmacy degree. And it was during my pharmacy school, which was in the 90s, that I first noticed the lack of safe and decent working conditions of health workers who were faced by the HIV/AIDS epidemic. In many cases, these were basic things, which could be like access to gloves or retractable needles or not given hazard pay. I did go ahead after pharmacy school to teaching because I was always invested in mentoring and teaching. And when the pharmacy school offered me a position, I gladly accepted. I was able to split my time between teaching and doing clinical wards for the first year to complete my internship. In Nigeria, internship is post-graduation, unlike the US here, before I transitioned into full-time teaching. Unfortunately, all that changed when my father suffered a grave injury. The limitations of the health and legal systems were very evident, and this was my driving force to move to the US.
So when you moved to the US, what were your next steps there? What led you eventually to go to law school and then everything that came after that?
When I initially moved to the US, I primarily worked in community practice, and this was for a number of reasons. The first and foremost being that I had personal responsibilities since my father's accident, and there was also a dearth of pharmacists in the US, and one could be sponsored for a permanent residency. However, in addition to my full-time work, I also took to volunteering as a pharmacist in impoverished neighborhoods, would do brown bags, blood pressure, blood sugar, cholesterol checks, and general health and well-being counseling. I would also visit senior centers, health fairs, and interact with doctors' offices and train other pharmacists. I think this gave me an opportunity to get a comprehensive look and gather insights into the health system. Regrettably, I realized that the unsafe work conditions were not only restricted to the global south. I did enjoy being a pharmacist and the satisfaction it brought. And because I really enjoyed being a pharmacist, I wanted to take these learnings to where I could influence policy and change. This led me to law school and my subsequent work at the Office of the High Commissioner for Human Rights and the World Health Organizations. I think working at all these levels, it was very clear that there was a lack of understanding and appreciation of what health workers face day to day, therefore leading to inefficient and ineffective health system policies and financing. From my experience, I was also aware that health workers themselves were many a times not cognizant of how to engage the system and demand these changes. this is really what propelled me to found the Health Law Institute, HLI, with a mission to bridge this gap.
Something that's particularly intrigued me about your story is that almost immediately after law school, you decided to found this international organization with very ambitious and big goals of protecting health workers around the world, instead of going down the traditional trajectory of, going to recruit, going to work at a law firm, which I think most law students do. So I guess there's two questions here, which is number one, at what point in law school did you realize that that's what you wanted to do? And number two, did you find it intimidating and frankly, like scary to start this, this ambitious project right out of law school?
I think that's a very complex question and maybe very different things. I think getting into law school, I was already aware a lot of these issues that were very important to me, but I think I had also received a lot of advice going back to school that, you should just be open to things. You should look at other areas. So I think going in, I was still trying to explore. I'd really say it was maybe my first year out of law school where this really started coming together. I think it started when I was at OHCHR, where I started realizing that, I think the policies that we had in place, how health systems could be fixed, really needed more focus on health workers. When I started at WHO, one of my, initial works was working on the zero discrimination statements for health systems. And I really felt that, the side of health workers were really left out, the discriminations they face. They're not only perpetrators of many of these actions, but they're also victims in many cases. So I think it was that kind of triggered me to say that, no, I think this is the time and this has to be done because we can't keep, developing policies without really getting the basic understanding of it. And being a health worker myself for such a long time, I felt I was in a position. It was very intimidating, and I think I'm still trying to figure out if this is the right thing. And I keep going back and forth. Was this something I could have achieved being in management? And it's still evolving. I think we're still yet to see what the impact is. I would say I was very happy having chosen to go to law school at University of Michigan because they had the Geneva externship program that kind of started me off this journey, and I was able to see things from a policy sphere than just being a health worker. So I think it's still undecided. We have to find out where it goes.
Thank you so much for discussing your motivations behind founding the Health Law Institute. I, for one, am very happy that you did this, and we can be here to support you. In terms of situating the organization, what was your motivation behind having it in an international sphere versus a regional sphere?
From my experiences both in Nigeria and the US, having worked as a health worker and also seeing a lot of the policy structures and systems in Geneva, I realized that, there are issues of safe and decent working conditions in all regions. And I think we were at a time thinking that what would be the best way to address it. I think when you start an organization, it's very much of getting the traction. And we felt just at least for me, being aware of what were, the opportunities in Geneva, both from the human rights angle and the health angle, it would be better to situate in an area where it was more accessible. All international organizations were accessible. At the same time, because these are things that you see in all countries, it could vary from one region to another, whether it was a resource-strapped dynamics or where, there were other issues, emphasis maybe on like a personal accountability versus structural accountabilities or many other issues. We just felt that international and a global approach to it would benefit it in the long run and also give us learning aspects of good practices from different areas that we could, bring awareness to.
That sounds great. Thank you so much. And do you have any specific goals for the HLI? Anything long-term or short-term you're trying to achieve?
HLI's vision is that all health workers will be supported and motivated to provide care commensurate with their skills in safe environments, under decent working conditions, and empowered to be true stakeholders in the development of sustainable healthcare systems. And I think to achieve that, the mission is to raise awareness, to engage stakeholders, and to educate and activate health workers as agents of change. Our arc of action, I think, involves research, education, advocacy, and change. We're still, in the early phases. We're just going to be 2 this year, so we're still trying to stabilize ourselves, network, and I think we're at the very early stages of getting that traction, being heard, and actually raise awareness and develop our health worker networks. So I think the long-term goal is to be able to influence policies in all the important areas. But for now, I think it's really building that credibility for ourselves and the workers we represent.
So going back to the discussion about these big goals and big objectives that the organization has, you must have faced some pretty big challenges along the way, including challenges that have arisen, I'm sure, out of the COVID-19 pandemic. So is there, would you be able to talk to that a little bit?
Yeah, I think it's kind of, there certainly are risks. There's risks to starting anything. And I think when I started HLI, it was certainly a career risk. And like we talked about even in an earlier question was like, what happens if you start and it doesn't go off as you want to? How does it? And so I think it was a professional risk I was willing to take because I felt that I had the information I needed. But at the same time, I was not sure. So it was certainly a career risk. The professional risk, I had a network of health workers, but really building it and being seen as an expert in your area is something that you need to develop yourself for. So professionally, it has been a time of really learning a lot of things in a short amount of time, being able to make that accessible for people. Financially was one of the bigger things and things that we're still concerned about, really getting it off this feet, being able to mobilize it and keep it going. I think what keeps me going for most of the time is the rewards. I think we've been able to engage with individuals. I have been able, when I talk to a lot of people, really see that these mean a lot to frontline health workers, a lot of my previous colleagues, and even strangers that I meet that speak up about, many of the things they face at work and which they're afraid to talk about. With the COVID pandemic, this has even become more prominent. We see a lot of disciplinary action. We see termination. We see lack of, decent working conditions. I think there's so many things that, we can go into that it merits a discussion on its own. The burden on health workers and the implications of the health system on COVID is something that would need to look at, I think, in an episode on its own. I think I would also like to hear, both of you have been very instrumental in shaping HLI. I look forward to your inputs. I look forward to the podcast we're doing today. And I'm sure the audience would love to also hear why you choose to be part of it and what interests you, what keeps you going.
So for me, I initially met Soosmita in a very not formal setting and slowly got to know about this organization. And also having my background in education is initially in science and then in law. So having somewhat of a similar background, nowhere close to the achievements and the things that has done, I was very intrigued and also started looking at some of the international mechanisms I was working in, just to look for any support organizations or initiatives that were working for the rights of healthcare workers, and I couldn't find many. So that I think is the biggest thing for me, where of course this is a very big issue and COVID-19 certainly has highlighted that. So I think now is the best time to really, really support the rights of healthcare workers. And I'm very excited to be working on this podcast.
That's awesome. For me, I think it actually is kind of a funny story. When I was originally looking for organizations to be a part of, this organization came up, and I was initially interested from my own personal experiences, looking for working for an organization that focuses on the patient side, but I love learning and I love researching and I love advocacy. And so I decided to speak with Soosmita about this organization and see what it was about. And right after the first conversation, I was very, very much convinced that this is going to be an amazing place to do exactly what I wanted to do, which is research and advocate. And I realized after talking to Soosmita that there really is a huge lack of advocacy for health workers, where there's already a lot of organizations dealing with patient side safety and all of that. There really weren't that many that deal with protecting health workers and advocating for them, which also I later realized in turn actually helps patient safety too. And so those were my motivations for joining. And I've enjoyed, every project that we've worked on ever since I've joined.
Thank you, Suk and Jacob. Yes, I do remember meeting was it the Geneva nonprofit, Suk? And I think we really tipped each other and, kind of what we wanted. It's just really finding that common goals and interests that's so important. I'm so happy that, you do help us out with all those things. And Jacob, I do remember our first conversation. I think that's always been a thing, getting individuals who, I think we're all patients and we see the patient advocacy very clearly because we can relate to it. And I personally find it very interesting to, open up this whole other side. And you're right, health worker safety always translates to patient safety and improved quality of care for the healthcare systems. So I really thank you for all the input and all the time that you help us with.
Of course.
Happy to help.
And so the next question that I have for you, Soosmita, is we've now started a podcast, and our listeners might be wondering, what are the goals that we have for the podcast? We already have blogs on the website. We already publish and present at conferences around the world. But why did we specifically start a podcast? Who's it targeted at? And what can it do for us that our other mediums of communication haven't been able to do?
Personally, I think whenever I have tuned into a podcast, I find it very accessible and informal and something that, you can revisit at your own time. Also, it's very interesting. I think there's always a difference between print media and something that you can hear, something that's audible. It speaks to you both in its tone and how it's laid out. And we're still yet to explore it. So I have to say that Suk and, you were very instrumental in kind of also pushing the ball to okay, let's get it started. I had it in mind, but it was something I wasn't always aware of. There are things that, I'm getting used to. So we will see how it really evolves over time. I think at the starting point, our thinking is that we really hope to talk with various professionals. And this could be a spectrum of actors, whether they were health workers themselves, patient advocates, policymakers, lawyers, government officials, activists, and it could be along the spectrum of their careers, right from students to youth, young professionals to people who are experts. And the idea is to develop a holistic picture of rights, responsibilities, and challenges of health workers and the obstacles they face in their delivery of care. And we all know that, the pandemic has brought a lot of issues to light. It has also shown us, the toll on mental health and self-care that's needed for health workers themselves. So I'm really hoping that this will be a medium for information sharing, and this would be able to engage the general public. They can relate to it. It'll be accessible and informative.
So as you've just started the podcast, have you solidified anything about the format or the schedule?
For a time frame, we're thinking doing it monthly. That's what we're starting off, to give it enough time for us to come together with ideas, to hear all of your suggestions, We'll update as new guests come in, but would also love to hear, from you. What would you like to hear? Would you want to be featured, or the things that you want to share with us? So I'd leave it open. We hope to post it on our websites and our social media accounts. But for now, we do think within monthly, we want to cover topics that are relevant, and also, topics that are important not only to health workers, in the perception of the general public, of the health workers, and how they can help as well in everything they do.
Thank you for all of that. That's going to conclude our first introductory episode of our brand new podcast. Thank you for joining us today to listen to this. Are you interested in requesting topics for future episodes or having us answer questions that you have? Well, if you go to our website and follow our social media accounts, which is all going to be included in the description below this episode, you can do all of that by messaging us. Thank you again, and stay tuned for our next episode.
Thank you, and hope to hear from you soon.